Washing Hands and Other Forms of Infection Control by Mary Ann Gillen. By the end of this presentation, you should be able to understand the different aseptic techniques in healthcare to prevent the spread of infection. Understand standard universal precautions. Learn how to wash your hands with soap and water per CDC and WHO, which is known as the World Health Organization recommendations. The use of hand sanitizer, and briefly touch on the use of personal protective equipment to help prevent the spread of infections via a video from YouTube. What is the role of infection? Basically, it is the prevention of the spread of infection. An infection is a process in which bacteria, virus, fungi, and other organisms enter the body, attach to cells, and multiply. To do this, they must evade or overcome the body's natural defenses at each step. And who is the main person who controls the spread of this infection? It is you. It is everybody's responsibility. How is infection spread? Knowing how infectious diseases spread will help protect you from getting sick while treating other patients and decrease the likelihood that you will spread the illness to others. Two main types of illnesses that you may be able to spread easily to other people are respiratory illnesses, those that affect your breathing, and foodborne illnesses, those spread by eating, drinking, and putting something in your mouth that has been contaminated. A common way for infectious diseases to spread is through the direct transfer of bacteria, virus, or other germs from one person to another. This can occur when an individual with a bacterium or virus touches, kisses, or coughs and sneezes on someone who isn't infected, as well as through the break of skin that comes in contact with a bacteria or virus. Thus, everyone becomes infected. How do you protect yourself? You protect yourself by using aseptic techniques, which is a method designed to prevent the contamination of microorganisms through universal precautions and through standard precautions. They are a set of infectious control practices used to prevent transmission of disease that can be acquired by contact with blood, body fluids, non-intact skin, including rashes and mucous membranes, from patient to yourself to other people by not using these precautions. Also, by the use of personal protective equipment, or PPE. A part of a standard precaution is for all healthcare workers to prevent skin and mucous membrane exposure when in contact with blood and body fluids of any patient. Personal protective equipment includes gown, gloves, eye protections, and face masks. The number one way to prevent the spread of infection is to have everyone wash their hands frequently. Hand hygiene is vital in healthcare, especially when working in a residential and aged care setting. Always perform the 5 moments of hand hygiene while working in a residential care setting. The 5 moments are: 1. Wash your hands before touching a resident. Wash your hands before performing procedure, after performing procedure or a body fluid exposure risk, after touching a resident, after touching resident surroundings. You can clean your hands by using an alcohol-based rub or wash them with soap and water. There are benefits to both. Alcohol-based hand rubs are often more effective in clinical situations because they require less time to use, are more effective in reducing the amount of germs on your hand, cause less skin irritation, are more easily accessible to staff, are more cost-effective, but if your hands are visibly dirty, you must wash them with soap and water. As you can see in this handout of how to hand wash with soap and water, and how to do a hand rub with alcohol-based formulation, is from the World Health Organization. Basically, what it is showing is how to wash your hands. You need to wet your hands first, then you need to apply enough soap to cover all hand surfaces. Rub your palms back to back, right palm over left dorsal with interchangeable fingers and vice versa, and then palm to palm with your fingers also interlaced. It is very important that you remember that you need to cause friction as you're doing this and have enough soap on your hands to get them thoroughly cleaned and have the soap turn into bubbles. This way you know that you are actually using that friction to wash your hands. You want to also put the backs of the fingers to opposing palms with fingers interlocked, rotating, rubbing your thumb into your left hand and vice versa. For the tips of your fingers and nails, you want to rub the back and forth with fingers claps of right hand and left palm and vice versa. This will help get the fingertips of both hands and nails clean. When you rinse your hands, you need to basically rinse from the wrist down, letting the water go down from your wrist down to your fingertips, rinsing them very thoroughly. Then you would like to take a paper towel and dry. You want to dry from the tips of your fingers, which is the cleanest part, down to your wrists, and dry them thoroughly. Then with that towel or a new paper towel, turn off the water with your hands. This should all take approximately 20 to 40 seconds for your hands to be clean. The basic is make sure that you wash your hands with soap and water. Approximately 20 seconds is the minimum amount of time. That is singing happy birthday to yourself or singing row, row, row your boat twice. Those are two helpful little hints that you could sing as you are doing this in your mind when you're washing your hands, to make sure you wash your hands for the proper amount of time. When you use a hand sanitizer, you basically do the same with the hand sanitizer as you would be washing your regular hands. You would put on enough hand sanitizer on your hand so that you may get them wet. You would either apply it with a gel that you would push down. They could be hanging on the wall, or you could be carrying your own hand sanitizer in your pocket, which is a good practice to do in a healthcare setting. You're going to rub your hands palm to palm. You're going to interlace your fingers back and forth as you're rubbing with the gel. You are also going to do the thumbs, and you're going to do the wrists. This will take approximately 20 to 30 seconds, or until the hand sanitizer is completely dry on your hand. Then your hands are sanitized in order to go into another patient's room for safe level. As I said earlier in the beginning of this tape, we were only going to briefly touch on personal protective equipment, or PPE. The equipment that you will need are goggles, a gown, a mask, and gloves. As you can see, the CDC has a sequence for putting on personal protective equipment that healthcare workers do follow. It is putting on the gown, then the mask or respirator, goggles or face shield, and then the gloves. And there are videos both on YouTube and under Google search that you could see someone putting these on in person. Then there's also the sequence for removing personal protective equipment. First, you're going to remove the gloves, being careful not to contaminate your hands by touching the outside of the gown or the outside of the of the other glove with your ungloved hand. Then you would take off your goggles or face shield. Then you would take your gown. Basically, you would unfasten the ties in the back, and then you would slip your hand underneath one shoulder and pull into the sleeve and pull it down. Then you would take the other hand and do the same thing with the opposite shoulder and arm. Then curl it up and roll it away from you so that you're touching only the inside that was not contaminated on the outside when you were in a patient's room. And then you would just disregard the mask or respirator, being careful to only touch the ties and not the actual masks itself. If you have any other questions, you could always ask your instructor for help. Once again, thank you for watching this video and hoping that you learned a little bit about how to wash your hands and why it is important to wash your hands with soap and water and with hand sanitizer. Also, learning how to do infectious control with your own personal protective gear that you would use when a resident is ill or in isolation for some type of illness or disease. Again, thank you. The end.